Now at 5, drug maker Pfizer says its COVID-19 vaccine has an effective rate of more than 90%. That's a much better than expected efficacy rate if the trend continues. Now, the company says it expects to have more than 1 billion doses manufactured next year, and it would be free to Americans. Here in the Big Bend, other trials and studies are underway. The main goal is getting control of COVID-19. ABC 27's Jada Williams joins us live from Bragg Memorial Stadium, a site that's become Tallahassee's go-to for testing. Jada, it's not the only location trying to get ahead of the virus?
Well, Channing, Bragg might be that go-to for testing. In fact, the line right now wrapped around that stadium, but there's a unique opportunity here in Tallahassee to be a part of the quest to save lives. Almost a year into the COVID-19 pandemic, scientists are now seeing hope for a vaccine. Drug maker Pfizer announced early data shows its COVID-19 vaccine has an effective rate of more than 90%.
Having an effective vaccine and one that's so highly effective is going to be really important to gain people's confidence in getting the vaccine.
The Pfizer vaccine is one of 4 in the country right now. Under President Trump's Operation Warp Speed, the North Florida South Georgia Veterans Health System is now looking for people to join Johnson & Johnson's vaccine clinical trial.
That is absolutely the most important news I've heard in a long time.
That's not the only study Operation Warp Speed is bringing to the Big Bend. Bond Community Health is also now looking for people to be involved in its study aimed at preventing COVID-19 related blood clots.
Even if you're not in the hospital, we're finding that people are going home to ride out the other symptoms of COVID and unfortunately are ending up having blood clots, stroke, clots in the leg, clots being thrown to the lung, or heart attacks.
Now, a call to anyone currently COVID positive and over the age of 40 to join the study.
This outpatient study looks at the possible benefit of giving COVID-19 patients a prophylactic blood thinner.
As trials and studies continue, one method is already saving lives: plasma donations.
The convalescent plasma has really moved to the forefront as a leading option in being able to treat many of these patients who have COVID-19. So we are continuing to collect and distribute COVID-19 convalescent plasma.
Anyone who has beat COVID-19 now able to help others by donating the antibodies found in their blood plasma. The best case until a vaccine is readily available to all. Now, if you are interested in donating plasma or getting involved in one of the trials mentioned in this story, you can find all of the necessary information on our website. That's WTXL.tv.
Jada, before we let you go, there's a difference between plasma and blood, but One Blood says they're both in crucial need right now. Why is that?
Well, the reason that blood donations are in crucial need is because with the pandemic, blood drives just aren't happening as often, so there's a shortage in those donations. Now, as for plasma, that is reserved right now for people who have the COVID antibodies, but anyone is still asked to donate blood. Reporting live, Jada Williams, ABC 27.
All right, good to know. Thank you, Jada.